Morning, guys. How are you? Hopefully, you are doing well. Well, this is Dr. Jayodasi, and I am going to start a high yield points lecture series for the medical students, and hopefully, you will get a lot of information from my high yield points. And like I have seen a lot of video lectures for Kaplan and from different sources on the internet, but I never found any lectures which only talk about the high yield points for the MCQs purposes. So I will start from the actually I have made a lot of high yield points from the Kaplan medical series, and mm, if you listen carefully these lectures, these high yield points, I think you will get a lot of information from them. So I think we should start with the pediatrics, and then we will go from pediatrics to gynae ops and medicine, surgery, psychiatry, and so on. So आवाज आ रही है सही? Hello. Okay. Now, if we start from the pediatrics, we have a uh, step 2 CK lecture notes Kaplan medical series, and when you open the pediatrics books you find that we have a 23 chapters there. Chapter 1, the newborn and resuscitation, then genetics, morphology, growth, nutrition, development, behavioral, immunization, child abuse, respiratory disease. Acha, after this these topics like start from the diseases of different organs, and that start from the chapter 8, respiratory disease, allergy, immune mediated disorders of the eye, ear, nose, then cardiology, GIT, renal, endo, orthopedic, rheumatic, hematology, oncology, neurology, infectious disease, and chapter 23rd, adolescence. So these all chapters, like all 23 chapters, I will try my best to cover these all topics. But before that, we start from chapter 1, the newborn and resuscitation. Now, before first of all, we'll talk about the APGAR score. Now, APGAR is a quick test performed on a baby at 1 to 5 minutes after birth. The 1 minute score determines how well the baby tolerated the birthing process. The 5 minute score tells the doctor how well the baby is doing outside the mother's womb. In rare cases, the test will be done 10 minutes after birth. Or APGAR is basically it's a Virginia Apgar. He was a MD, and he uh, born in 1909 and 1974, died in 74, and then he gave this APGAR score idea in 1952. Now, how the test is performed? The APGAR test is done by doctor, midwife, or nurse. I mean, anybody can do this, and uh, I mean, what the doctor is looking for? He is looking for the breathing effort, heart rate, muscle tone, reflexes, and skin color. And each category is scored with 0 to 2 depending on the observed condition. Now, if baby is doing well, he get the 2 points, and if baby is doing poor, she or he gets the 0 points. Now, breathing efforts. If we talk about the breathing efforts, if the infant is not breathing well, the respiratory score is 0, and if respirations are slow or irregular, the infant scores 1 for respiratory effort. And the infant cries well, the respiratory score is 2. Now he is doing well if he cries well. Then he get the maximum score 2. Heart rate is evaluated by stethoscope. The most important assessment क्या होगा? What will be? If there is a no heartbeat, the infant scores 0 for heart rate. If heart rate is less than 100 beats per minute, the infant scores 1 for heart rate. And if heart rate is greater than 100 beats per minute, the infant scores 2 for heart rate. Now maximum, I mean greater than 100 beats, 2 score. That's the baby is doing well. It means if heart rate is after, I mean greater than 100 beats. Now muscle tone, 0 for floppy, and the active motion, you get the 2 points. And then we check for the skin color. Now why the test is performed? The test is done to determine whether a newborn needs help breathing or having heart trouble. Normal results, that comes from 1 to 10. The higher the score, the better the baby is doing well. Okay, a score of 7, 8 or 9 is normal and is a sign that the newborn is a good health. A score of 10 is a very unusual, since almost all newborns lose 1 point to blue hands and feet, which is normal for the birth. Blue hands sometimes is only 1 point every child loses, so it's rarely the child can get a 10 points. Maximum if is a well, you know, as a baby is a better and baby is doing good after the birth, he might get a 9 points. And what do you mean by abnormal results? What do you mean? It means it was a difficult birth, whether in a C-section or a, you know, the fluid in the baby's airway. So what the baby need with the low APGAR score? She needs the oxygen and clearing out the airways to help with breathing, and physical stimulation to get the heart beating at a healthy rate. Most of the time, a low score at 1 minute is near normal by 5 minutes. Okay.